Okay.
Ready.
Should I start?
Yeah.
Okay. So our presentation is on depression in adolescents. Okay. So, okay. Hi, my name is Lean Estabal, and I'll be describing the issue of depression in adolescents. So, what is depression in adolescence? Well, depression is a mental health mood disorder that ranges from unhappiness and discontent to extreme feelings of sadness or pessimism that interferes with daily life. And then adolescence is the period of transition between childhood and adulthood, usually from age 10 to age 19. So essentially, we're talking about depression and what we know, like colloquially, to be tweens and teenagers. An important note about depression is that it's very different from mood swings or temporary feelings of sadness. When we describe depression in adolescence, we're talking about long term feelings of despondency, usually classified as lasting for 2 weeks or longer, and those aged 10 to 19 to the point where it interferes with their lives. So, depression in adolescence can have many causes, including a genetic predisposition to depression. So, a parent or a relative has depression, and then they'll pass that trait on to their offspring. Peer and academic pressure, a difficult home life, such as abuse, substance abuse, and much more other causes. And some symptoms of depression in adolescence include not enjoying activities as much as they used to, such as hobbies or sports, having constant feelings of sadness or irritability, social isolation, so spending less time with friends or in after school activities, fluctuations in appetite, weight, and sleep, so not eating as much or eating more, not sleeping as much or sleeping more, having trouble concentrating, having suicidal thoughts, and more.
Hi, my name is Jasmine, and I will be discussing the significance of depression in adolescence. Depression in adolescence is a well known public health issue because it affects millions of teens each year. In fact, about 1 in 5 adolescents experience some kind of major depressive episode annually, showing how common it is. Not only does this signify the importance of mental health, but depression has shown serious consequences such as poor academic performance, substance abuse, and social withdrawals in teens. It is also strongly linked to suicide, which is a leading cause of deaths in adolescents. Research has shown that around 2 in 10 teens have considered suicide, while 1 in 10 have attempted it. This issue is especially important because depression during adolescence can continue into adulthood, leading to long-term mental and physical health problems. Overall, the widespread impact and outcomes of adolescent depression make it a serious public health concern. So, why should we care? This issue is important because it affects more than just the individual, impacting families, communities, and impacting families, schools, and entire communities. When teens struggle with depression, they're more likely to struggle in school, drop out, and take part in substance abuse. Another major concern comes from the fact that about 60% of adolescents with depression do not receive any mental health treatment. This is caused by stigma, lack of resources, and limited access to care. Due to this, it's important for early intervention. Providing support and treatment early can dramatically reduce long-term mental health issues, lower the risk of suicide, and improve health outcomes for the population.
Hi, I'm Samantha Bollinger, and we'll be talking about depression over time. Adolescent depression has become a critical public health crisis, and the numbers are both alarming and deeply concerning. Suicide is now the third leading cause of death among young people aged 15 to 29, highlighting just how serious this issue has become. Over the past decade, we've seen a significant rise in depression rates among adolescents. Between 2009 and 2019, rates increased for both boys and girls, but the increase was far more dramatic for girls, as demonstrated by this graph. rising by 12% compared to just 3.7% for boys. This widening gap points to underlying social, cultural, and psychological factors that may be affecting young women more intensely. At the same time, data from the CDC shows that more high school students than ever are reporting persistent feelings of sadness and hopelessness. These aren't just occasional bad days, these are ongoing emotional struggles that can impact academic performance, relationships, and overall quality of life. When left unaddressed, these feelings can escalate into more severe mental health challenges, including self harm and suicidal ideation. The COVID-19 pandemic further intensified this crisis. During periods of isolation, uncertainty, and disruption to daily life, many adolescents experience heightened levels of anxiety and depression. What's especially concerning is that these effects didn't disappear when lockdowns ended. Studies show that mental health challenges have continued well into the ongoing pandemic period. All of this underscores the urgent need for increased awareness, early intervention, and accessible mental health resources for young people. Addressing adolescent depression isn't just about treating symptoms, it's about creating an environment where young people feel supported, understood, and able to seek help without stigma.
Hi, my name is Britton Ashcraft, and my slide is on the impact of this issue if it is not resolved. So, if this issue is not resolved, not only will depression continue to rise, but it can also lead to long term health effects, including heart disease, diabetes, or even cancer. According to the MTP Psychiatry, 1 in every 4 adolescents experience depressive symptoms in August of 2025 versus in 2015, which was 1 in every 6 adolescents. From this statistic, we can assume that if depression in adolescence is not resolved, depression will continue to rise and the health of America will decrease every single year.
Hi, my name is Suzanne Finchnet, and I will be covering potential mental health solutions for our issue. Adolescents may experience depression for a multitude of reasons, but from what we know, the most effective solutions in combating depression in adolescents are rooted in establishing connections. In public health, we look at a multiple of factors that influence individual health, such as social determinants of health. In this case, with depression in adolescents, depression may be caused by a number of things, whether they feel like they are lacking somewhere within their social life, environmental conditions, financial instability, or abusive home life. So, some resources that we can provide adolescents with include the Suicide and Crisis Lifeline at the number 988. We can also provide counseling and therapeutic services, and this can be facilitated or bridged between both doctors' offices, schools, and just any other concerned neighbors or parents, family members looking to support their youth. There are also in school solutions that we may provide our adolescents with as well, such as mental health awareness initiatives. This may be seen in the form of posters around school detailing, such as what is on this slide, detailing signs of depression, what to look for, and how to go about it, which not only informs students who themselves might be experiencing depression, but as well as their peers who might be concerned for one another as well. Other mental health awareness initiatives also might include uh, educational meetings. For example, a school might put out a screening survey, which may survey the mental health of their students at the time. And we can use this information that we collect from these surveys in order to guide future initiatives in order to make sure that the mental health of students within our schools is at the best that it can be. We can also provide mental health training for staff. This would include making staff aware of the signs of depression in students, um, making sure to report them to parents if need be, depending on the situation. Schools can also help create supportive environments for the students as well. This would entail initiatives against bullying, cyberbullying, and just overall creating a happy, positive, and safe space within school, which in some cases adolescents might not be getting at home. We can also support adolescents through on site counseling. In terms of social welfare, as I stated earlier, connection is super, super important in making adolescents feel welcomed, loved, and supported, which directly combats depression. We can encourage communication, supervision, and connection through community events, parents, and people closest to our adolescents as well. The key to providing adolescents with the support that they need.